Hello and welcome to the YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. I am your host physiotherapist Meghana, and in today's video I am going to share with you 3 things that you should absolutely avoid when you are in early days of Bell's palsy and 3 things that you should do in order to get better recovery from your Bell's palsy. So if you want to know all the 6 things, make sure to watch this video till the end. So let's begin. Friends, many of you who are suffering from Bell's palsy reach out to me asking some of the common questions. One of the most common question among that is, how long will it take to recover from Bell's palsy? Well, I have also explained the answer of this question in my previous video, but I thought I should answer it again. So your recovery from Bell's palsy basically depends on the certain factors, and one such important factor is the degree of nerve injury. What is this degree of nerve injury? I've already mentioned in my previous video, so make sure to watch that video as well. But to explain you in short, there are 3 degrees of nerve injury that can happen due to Bell's palsy, which means at 3-degree level the severity is dependent. First degree of nerve injury, which is the most mildest form of nerve injury, in that case you will recover in 3 weeks of time without any major residuals. If you have got 2nd degree of nerve injury, then you might take a little longer, say somewhere around 6 months to 8 months to recover completely from your Bell's palsy problem. And if you have got a 3rd degree of nerve injury, which is the most severest degree in the Bell's palsy scenario, then you might take more than a year to recover completely. That's the reason whenever a patient comes and asks me how long will it take, the recovery is very slow, I always tell them wait for 3 months, give yourself 3 months of time to actually see how much the nerve damage is there, and then only you will get an idea that how long it will take to recover. There is no way to figure out in early days itself to what degree or else to what level the nerve damage has happened. Friends, when you experience Bell's palsy, it's very obvious that you will be distressed, you would be scared and you would be anxious. In this anxiety, I have seen many of the patients make some of the mistakes which leads to a complication called a synkinesis or else delayed recovery. So what are these mistakes which you should absolutely avoid? Let's have a look at this first. So the first mistake that you are making if you are having Bell's palsy is worrying too much, getting anxious and getting tensed of what all this has happened and what's going to happen, how I'm going to continue work. What I would suggest is it's okay, accept the fact that yes, Bell's palsy has happened now and it will take some days to recover. So give your body that time to relax completely. Take a good break from your work, sleep well, take your rest well, take your medicines on time, and take care of your eyes, which is the most crucial and important thing. Take care of your ears. Cover your ears very well whenever you are inside the house or else you are stepping outside the house, because there is an inflammation that has happened inside your ear which needs healing time. And if your ear is constantly exposed to other irritants, the healing will be delayed. So the first tip that I would like to give you is stay away from tension, stay away from stress, stay away from anxiety and worries. Let yourself and your body heal completely. What you can do at this point of time is do a lot of meditation, a lot of breathing exercises and relaxation in order to gain better recovery from Bell's palsy. The second mistake that you should absolutely avoid during Bell's palsy time is forcibly doing exercises and trying to do more and more of exercises. It's very obvious that you will think that okay, let me talk more, let me try to move my face muscles more so that they will start automatically working. But in Bell's palsy, it doesn't work that way. Just imagine that your nerve, the facial nerve that's present inside the ear, is the plug point from where the nerve is starting and carrying the impulses and supplying to all over your face. Just imagine if there is no power in that plug point, how come the muscles are going to work, or else how come the light is going to on? Similarly, here also your muscles will not work, and if also they are working and if you are trying to forcibly do the movement would be coming from the normal side, which means you would be doing mass movement patterns. Mass movement patterns is one of the leading cause for synkinesis. If you are constantly trying to do mass movement on your face, which means forcibly trying to raise your eyebrows, forcibly trying to close your eyes, forcibly trying to flare your nose, forcibly trying to smile, forcibly trying to blow air, if you put force, what you're doing is you are trying to take the energy from here and shift here. Now this is the time when the nerve is healing. The nerve doesn't know where I have to go and start giving my impulse, so they will start getting signals that okay, I need to supply here, so they gradually starts branching out in wrong places, and that's what is synkinesis. When the nerve which is supposed to supply to your mouth muscle, it also branches out and starts supplying to your eye muscle, and that's why later on in later cases the synkinesis happens. When you are trying to smile, your eyes get smaller, or else whenever you are trying to close your eyes, or whenever you are trying to blink, your mouth deviates to this side. So that's a typical sign of synkinesis, which only happens due to a lot of exercise practice. Yes, exercises are important, but it has to be graded, it has to be gentle, it has to be slow, it has to be on the basis of how the muscles state, or what's the state of your muscle impulses that's present. Do not forcibly try to do any exercises. That's the most biggest mistake that you will make during Bell's palsy. And the third and the most important mistake that again you should avoid during your early days of Bell's palsy is trying to get more and more electrical stimulation. Many of you reach out to me asking that shall I continue electrical stimulation or not? Well, my answer is electrical stimulation is only required to the point where you are having no movement or a zero contraction on your face, where your face is completely paralyzed, completely null. And if you ask me, even that time also the nerve has the ability to regenerate on its own, recover on its own, so you don't actually need electrical stimulation. But still, that's the point that is safe to take electrical stimulation. Once you start getting contraction on your face, electrical stimulation is not going to help. It will not impact, or else it will not contribute to your recovery at all. And this is not I'm talking just by my experience, but I'm talking by the research papers and the evidences that are present in the scholar articles or as medical journals. So electrical stimulation is not something that is advisable for a long term of time, so don't be tempted to continue electrical stimulation or else take more and more electrical stimulation thinking that you would recover by taking that. Instead, here are some things that you should do to get better recovery from Bell's palsy, be it from first degree of Bell's palsy, second degree of Bell's palsy, or else third degree of Bell's palsy. So what are these things? Let's have a look. So the first and the most important thing that you should do during your early days of Bell's palsy is giving your face good amount of hot fermentation. Yes, hot fermentation kind of increases the blood supply on your face. It kind of relaxes the facial muscle, especially on the non-affected side. Yes, when your face is totally paralyzed, your non-affected side has to work way more harder. Every effort that your face is doing is coming from here, so it also needs some level of support, some level of relaxation. So give that relaxation with the help of hot fermentation. So hot fermentation will not contribute to the recovery. Make sure it is not for the recovery. Hot fermentation helps to relax the tensed facial muscles and helps to maintain a good blood supply on your face. So the way you can take this hot fermentation could be by a simple method of steam inhalation, or else what you can do is you can apply a hot pack all over your face. This hot pack can be in the form of a hot water bag, or else you can just take a skillet. On that skillet, place a clean dry cloth over it, warm it up, and then place it all over your face. You can do this for say around 5 minutes for 2 times in a day for few days. or else you can continue it for long also, because it doesn't harm as such, because it's just for relaxing your face. That is something that will really help you out, not only in facial relaxation but also in dealing with your ear pain symptoms, also your facial pain symptoms. So that's the first thing that you can do in the early days of Bell's palsy. The second thing that you should do in the early days of Bell's palsy is focus more towards massage. Yes, massage is most important thing, the most crucial thing during Bell's palsy recovery time. Now, why massage? Again, the purpose here is the same. It increases the blood circulation. It maintains a good flexibility in your facial muscles, which it prevents your facial muscles from getting contracted or is developing atrophy or contractions, and thus helps in better recovery to happen. When your facial muscles are relaxed, when your body overall is relaxed, the nerve will get enough room to recover. Your body will get enough room to recover. So facial massage is super important. I've already made a video on how to do facial massage. Make sure to watch it in order to get a guidance of how to do facial massage during the time of Bell's palsy. The next thing that you should do during the time of Bell's palsy, yes, I've already mentioned about eye care. I've made a total entire complete video on eye care during Bell's palsy, so you can watch that. So I'm not going to mention about that. But the second thing that you should do during Bell's palsy is stretching your non-affected side. Yes, your non-affected side of the face is again into contraction. There's a lot of force that is exerted there, and they need to be more stretched, they need to be more relaxed in order to gain back your symmetry. So the way you can stretch your normal side of the face during the early phase of Bell's palsy is with a very simple method, which is something like this. You have to keep your hand underneath your scalp, and then with the help of other 3 fingers you are going to pull and try to close the eyes this way. Do this for 5 times. Same way from here. Do it this way. Remember, I'm doing this on my non-affected side, not on the affected side. Then this way. So what I'm trying to do is I'm trying to bring my non-affected side facial muscles towards the center, as towards the midline. So I'm stretching my muscles in those directions. Then you have to put one thumb inside your mouth, and then with the other finger you are trying to pull this way. One, two, yes. So that's how you're going to stretch your normal side of the face. Next and the last important thing that comes is taping of your facial muscles. Yes, taping gives support to the affected side because the muscles are constantly drooped down. So they start feeling achy, they start feeling unsupported, and taping helps to give that support. So how to do this taping? Let's have a look. So friends, these were the 3 most important things that you should do in order to get better recovery from Bell's palsy, and 3 important things that you should not do in order to avoid getting synkinesis or else getting delayed or else wrong recovery from Bell's palsy. You can also say these are some of the mistakes, 3 mistakes that you should avoid while going through Bell's palsy. I hope you found this video helpful. If yes, make sure to like this video, share this video, and do subscribe to HealthQ channel to watch such health awareness videos. I'll see you in another video. Thank you.